Hello everyone. Today we will discuss about the liver, an extremely vital organ. The liver is shaped like a cone and dark reddish-brown in color. Liver cells can divide and regenerate fast to compensate for any damage or loss in any portion of the liver. But what if the cells keep dividing uncontrollably? In this case, it might be a liver cancer. Our role today is to answer most of your questions regarding liver cancer. Today we have Dr. Na, who is a leading doctor at Bucheon St Hospital. He is going to discuss with us everything about liver cancer from an experienced medical point of view. I'm Ume. Before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Hi, Dr. Na.
Hello.
Nice to meet you. Before we start, briefly introduce yourself.
I am Nangan Hyung from Catholic University St. Mary's Hospital in Bucheon, specializing in hepatology.
So, Dr. Ka, what are the different kinds of liver cancer that exist?
Liver cancers can be largely divided into cancer that begins with the liver and those that have to spread to the liver. Liver cancer is frequently spread to the liver from cancers occurring in other organs. So there are far more cancers that have spread into the liver than ones that originally began from the liver. Today we discuss primarily liver cancer. More specifically, we will discuss liver cancer that starts within the cells of the organ, hepatocellular carcinoma, and cholangiocarcinoma. Hepatocellular carcinoma is known to be difficult to detect. The reason is that there are almost no symptoms, and thus, detection tends to be late. These cancers tend to occur not in healthy livers, but those affected by cirrhosis, and has been in steady decline of function. Thus, even treatment is difficult, and is a hard cancer to fight off.
So you just talked about what we call in English HCC, right? Or hepatocellular carcinoma. So what is the etiology behind HCC?
The most common cause is the virus that affects the liver, particularly hepatitis B and hepatitis C viruses. These viruses can cause liver cirrhosis. For Asians, hepatitis B is common. In the West, it is typically hepatitis C that causes problems. Lately, there are many treatments and vaccines against hepatitis B and C, so both in Asia and the West. Hepatitis is decreasing. Instead, heavy alcohol use is playing a big role behind liver cancers. Also, non-alcoholic fatty liver disease, NAFLD, is also playing a role behind liver cancer as a new problem.
Does it have any particular symptoms?
Most do not have symptoms early on, but as it is often discovered late, there are symptoms such as tiredness, jaundice, but nothing clearly specific to the liver cancer itself. Many get discovered without symptoms during a periodic checkup exam.
So usually how is it diagnosed?
The diagnosis of liver cancer has some differences with other types of cancers. For example, stomach or colon cancers, a biopsy is mandatory to ascertain. For liver cancer, we diagnose with just imaging results. So, we rely heavily on imaging diagnosis. We use a CT with contrast dyes or MRI to diagnose. So whether a tumor marker comes off the cells or blood work, we can ascertain the diagnosis. In cases where these techniques do not work, we perform a biopsy.
So if the diagnosis is done and it's confirmed it's HCC, how is it then treated?
The treatment methods are quite different also. Just like the diagnosis, the reason is that the liver is crucial for life. For example, stomach, colon, and thyroid cancers. The treatment can be a full removal of the affected organs. If we remove the colon, life is affected but can carry on. However, if we remove the entire liver, we cannot live. While it is important to know how much the cancer is spread, we have to focus on preserving the function somehow, as the liver is crucial for life. So even if the cancer is detected early, if the liver is not functioning in full capacity, we may not be able to treat it surgically. Also, the opposite is true. Even if the liver cancer is more developed, if the function is intact, we may treat it more aggressively.
So is surgery also an option?
There are many types of treatments. There are radical treatments and traditional treatments. The first are treatments where a full recovery is expected. The primary of such treatments is surgery. There are partial removal surgery and liver transplant surgery. Lately, we always have high-frequency heat treatments. When these radical treatments are difficult to administer, we try treatments such as hepatic artery stenosis surgery, chemotherapy, radiation therapy, etc.
Okay. So you talked briefly about surgery as a solution. Can you please further give details?
Of course, I tend to explain the importance of surgery as I am a surgeon. It is the most important to find out whether the patient can have removal surgery or not. Relative to other treatments, the results are superior. But as I said before, we can only perform the surgery if we can maintain some level of liver function. Sadly, for some patients, even if detected early, we cannot do surgery since the liver function is compromised. So if the patient is able to undergo surgery and maintain some level of acceptable liver function, we proceed. For those who are at the early stage, but their liver function is very compromised, we can consider liver transplants when possible.
Liver transplantation, is it also an option for HCC patients?
Liver transplant surgery is fundamentally different than other cancers. It is the best treatment for liver cancer. The reason is because instead of treating the affected cells and its consequences, a transplant essentially resets the liver functions with a new intact liver without any issues. The issue is that the transplants require a very specific criteria. There are standards set for this procedure to become possible. There is a criteria called the Milan criteria. The Milan criteria states a single tumor less than 5 centimeters in size, or no more than 3 tumors, all less than 3 centimeters in diameter, and has not metastasized to other areas. If the Milan criteria is met, the results can be expected to be very good. While there are exceptions with good results, we tend to focus on those who meet the criteria for transplants.
So Dr. Na, what is radiofrequency ablation?
Well, we explained the surgical methods above. Now we should talk about the non-surgical treatments. Like we said, there are radical methods and more traditional methods. Aside from surgical methods, RFA or radiofrequency ablation is included as a radical method. This technique uses insertions to the affected area to essentially roast the tumor. The size of the tumor needs to be small and away from larger veins nearby. According to some studies, the expected results are similar to surgery. RFA, while a non-surgical method, is considered a radical treatment.
So RFA, there's also, I heard about what is called TACE.
Aside from the treatments mentioned, there is a treatment called TACE, or transarterial chemoembolization. This treatment is for those who radical treatments are not possible. There are patients who receive good results even with treatments like TACE.
So in the case of liver cancer, just like other cancers, is chemotherapy also used?
Chemotherapy is not used when the cancer is contained in the liver alone. While there are many new chemotherapies available, we use it when the cancer is spread to other organs. But the efficacy is lacking, frankly, relative to when applied to other cancers.
Okay, so let's talk a little bit more about the survival rate after HCC or the recurrence after a full treatment.
Lots of treatments, including RFA, TACE, etc., have progressed a lot. But the surgical method of liver transplants have become very standard. The techniques used in surgery have also progressed a lot. Also, the multidisciplinary team's care of patients before and after have improved greatly. Relative to the past, the results of liver cancer treatment has improved clearly. But while the liver cancer treatments are important, the patient has to steadfastly care for his health afterwards, as the lifestyle itself may have contributed to the problem itself, because while many die due to cancer, many die due to lack of liver function itself. So it is key to maintain a healthy liver after a successful treatment.
So, as a doctor who works a lot with the liver cancer patients, is there any suggestions to prevent this kind of sickness?
When we observe our patients, even if they are not cancer patients, there is always a test for hepatitis B or C. Some come up positive for the virus, but mostly do not get any treatment for the virus infection. Even if they have no symptoms, they should periodically check for issues and the possibility of turning worse. So it is recommended that they regularly get exams. Also, excessive drinking should be limited, especially those with hepatitis infections.
That's it for today. Thank you, Dr. Na, for being here. So today we learned many things about liver cancer. Thank you once again for joining us today at CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.